now we're in Quito, Ecuador, which is our core site in Ecuador. Ecuador is actually one of our longest relationships in terms of Northwell Global. Dr. Rafael Barrera, who is Ecuadorian and our director of our SICU at LIJ, has been doing surgical missions to this country for 17 years.
Well, this program started after a failed mission of some people that I knew, and they asked me if I knew anybody that can do it. I said, I'll do it. So we decided with a couple of surgeons and friends of mine to start the mission. We thought it was going to be only a one-year deal. And 25 years, here we are with a mega global program, which I think is one of the most complete programs in the world at the present time.
And the amount of work that they've been able to do in terms of working on complex cases, working alongside Ecuadorian surgeons, launching and spearheading the only bariatric surgery program in Ecuador.
We started to do some bariatric surgery with their surgeons. The goal being to provide the best care, to give them some of the techniques that will allow these operations to be done safely and that the patients can go home in a very short period of time. Again, that was the impetus initially for the laparoscopic hernia repair. These patients don't have time. Some of them come 5 hours from the Amazon, some of them come from north in the mountains.
And we have medical students aligned with them. They're seeing what they're doing, they're interacting, they're interpreting, they're learning, which is a great thing.
And as a matter of fact, Sunday we saw one of our patients that we operated when he was 3 months old. Now he is 21, he's a mechanic, and another one that we will be operating Thursday, he's a journalist now, and we operated him when he was a baby. So it gives you a good sense that you actually are not only doing surgery, you're actually changing lives.
My hope based on our meetings here is really the expansion of mental health services for not only Quito but for the country. The benefit of working here in Ecuador is, socialized medicine allows us to do things that we wouldn't otherwise be able to do in the States. And, the models, the studies, the theoretical frameworks all exist in public health, but these kind of systems of inequity hold us back.
We're taking a model that we started during the pandemic, which is a telepsychiatry model, which was really bringing psychiatry-based care to the primary care health centers, and we're taking that model and expanding it. And one of the things that's really exciting about that is in Ecuador, there's really a very formalized structure, and psychiatry and all these specialized services sit on the tertiary care model. Unfortunately, the tertiary care model is so overwhelmed and so backlogged that I call it the black hole. Patients go in and they never come out.
So our strategy has several components. One is to screen patients to help identify which patients in the community are experiencing a mental illness, and then once identified, to refer them to assessment with either the primary care physician or a telepsychiatry consultation with one of our people. We develop recommendations and then provide those to the family practitioner, who then manages the patient with medication. One of the real strengths in Ecuador is many of the primary health centers already have a bachelor's level psychologist embedded or associated with the clinic. And so that's something that in our clinics here in the US, I would love if we had that, because that's someone who can be trained to provide evidence-based psychotherapy and really improve access. And remember, psychotherapy and meds are the two main approaches to depression and anxiety. They're equally effective.
And so we've been, just during the pandemic, remotely been able to take the turnaround time for a psych consult at these clinics that we're piloting this at from 2 months down to 2 weeks. This is a model that we're not allowed to do in the United States. So the potential for the primary care behavioral health model here actually could disrupt some of the problems that we've had in New York with delivering efficacious, good primary care-based mental health care. This is something that Northwell's very excited about, because this is something we struggle with in New York because of regulations, and it's something that Ecuador, specifically the Minister of Health, is very excited about. He's given us a district in Ecuador, which includes 10 clinics and a referral hospital, to create a best practice model.
So you come back to the US and it's like, okay, how can we sort of take that creativity and innovation and that resourcefulness and kind of that same spirit and recapture in a sense the joy, meaning and purpose of medicine, but also like thinking out of the box and coming up with new ways of improving access to behavioral health.
One of the things that's amazing about Ecuador, and one of the reasons why it's one of our core sites, is just the amount of connectedness between the Ecuadorian population in New York and the Ecuadorian population here. There's a huge diaspora. The community pays very close attention to what's going on in their home country. What we do here matters in New York. It matters to our team members that are Ecuadorian and our patients that are Ecuadorian, and we're really excited about this global local connection.